Hi everyone, today I'm going to be discussing the title Patient Characteristics and Experiences Associated with Trust in Specialist Physicians. Do patients feel trust in specialty practices, or do they feel doctors are more distant and tend to care less about their health due to less time spent on average when the time they're together? Although patients visit specialty doctors as much as their primary care doctors, not much has been discussed and investigated in regards to how outpatient patients feel in regards to the experience they encounter in their patient-doctor relationship with various specialty areas of the medical field. The following I'm going to be discussing the article Patient Characteristics and Experiences Associated with Trust in Specialty Physicians. And I'm going to focus on the authors of the research, as well as the problem and question of the study, and the research findings results. First, the researchers of the article. The title of the article, In Patient Characteristics and Experiences Associated with Trust in Specialist Physicians. The article was published by American Medical Association back in 2004. So the research does go back a little bit. Also, there were 5 authors involved in the research in the process throughout researching this study. The authors worked under the Division of General Internal Medicine at Brigham and Women's Children's Hospital. I'm going to focus today on 2 authors. The first one that I'll be discussing is Nancy Keating, MD, MPH, and the second one is Tejal Gandhi, MD, MPH. Both researchers were physicians under the Division of General Internal Medicine at Brigham and Women's Children's Hospital at the time, and also they were professors at the Department of Health Care Policy at Harvard Medical School during the research as well. According to the Harvard website, Nancy Keating, Dr. Keating's research examines provider, patient, and healthcare system factors that influence the delivery of high-quality care for individuals with cancer. She's still a physician at the hospital, same hospital, and she also is a professor at the Harvard School. Likewise, Tejal Gandhi, she's the president and chief of the Institute Executive Officer at the National Patient Safety Foundation. Moreover, according to the Institute for Healthcare Improvement, Dr. Gandhi is an advocate for patient safety at the regional, national, and international levels, driving educational and professional certification efforts, and helping to create and spread innovative new safety ideas. Her research interests focus on patient safety and reducing error using information systems. Going back to Nancy Keating, she's also somebody that's focused on high quality care for patients with cancer. Both of these were some of the others involved in the research, but I focus on these 2 because there seemed to be more information about them online. In regards to the study design, according to the article, the researchers investigate about patients' outpatient experiences with specialties on how patients' characteristics experiences are related to trust in specialist physicians, according to the Medical Association. The research involved is to explore patients' emotions in regards how they feel in regards to the doctor-patient relationship with their different specialty doctors. Healthcare providers need to care and be involved because it involves everyone. There is more diversity in patient populations, hence providers need to be more competent in various cultures, which involves understanding patients and how they feel about their care. The method utilized in this research was qualitative, as a research method was also a written survey. It was 417 patients that participated all total, with different specialist visits to cardiologists, neurologists, nephrologists, gastroenterologists, and rheumatologists practicing in hospital-based settings. In regards to the research findings, most patients reported good experiences and 79% reported complete confidence and trust in their specialist. All this was dependent on different things. Black patients were less trusting than white patients. Patients were more trusting if they reported that the consultant listened to their concerns, if they received as much information as they wanted, and were told what to do if problems arise or if they got worse, and when to return to the clinic, and also if more time was spent with their specialist. And this is all according to the American Medical Association. Also, if patients feel like their provider cares and are involved in their case, then the patient is more likely to open up and feel trust in the medical field and their specialty doctor. However, if patients feel like their concerns are not listened to, then their experience with different specialties is usually negative. Similar research done in 2010 was the article titled Physician Specialty and the Quality of Medical Care in the Experiences in the Context of the Taiwan National Health Insurance System. It was published by Journal of the American Board of Family Medicine in 2010. According to the results of the article, having a primary care physician was significantly associated with patients reporting higher quality of primary care experiences, specifically related to specialty care physicians. Primary care physicians enhanced accessibility, achieved medical community orientation and cultural competence, and provided more comprehensive services. In conclusion, the article patient characteristics and experiences associated with trust and specialty physicians. Authors well-known physicians at Brigham and Women's Children's Hospital during the qualitative research method conducted as a survey identified patients feel closer to the provider regardless of the specialty, depending on the attention and dedication provided by the specialist. Patients want to be heard and feel important to feel closer to the providers. As long as they feel heard, when they develop trust in the provider and healthcare field, then they will eventually develop that trust, as long as they feel important enough to be heard.